Okay. All right. So Samantha, continue to tell me a little bit more about what you were experiencing.
So as a result of the anxiety, the high anxiety, with the rigorous learning of teaching students the content and the assignments or whatnot, it doesn't allow me to complete assignments in a timely fashion and have them submitted at the scheduled time. Um, and that causes me to worry even more. Already like at a stress level that is beyond the roof. But I keep going because it's very unfamiliar to me, to my brain, to my thought process, and sometimes I just want to lay around and not fool with it at all.
Okay. Okay. So what I'm hearing you say more than anything is that you're experiencing a lot of stress and you're experiencing a lot of worry. Is that right?
Yes.
Okay. So let me ask you this. You decided to come to therapy, which I think was a great idea. What do you expect to get out of therapy? What are you looking to get out of therapy as it relates to this stress and this worry that you're experiencing?
I would say probably better time management.
Okay.
Um, Finding more balance, and hopefully the ability to organize my the assignments, my personal life, and my work life.
Oh,
Just
okay.
trying to balance with that.
Mhm.
I'm finding without all three of those things, I'm very off balance, and yeah.
Okay. So prior to coming to therapy, have you tried anything? Like, have you done anything to basically better try and manage your time, find balance, organize, and your personal life? Have you done anything on your own prior to coming to therapy to try to see if you could possibly figure that out?
I did try to etch out like certain amount of hours in a day, like on the weekend, maybe I say 8 a.m. to 12 a.m. to work on homework and lesson plans or that to that nature. And I'm finding that that's not working because somehow or another I always end up getting sleepy or getting overexerted because of all the reading or assignments I have to do, or I get distracted some kind of way.
Okay. Okay, that's understandable. So you said sometimes it doesn't work. Can we talk about a time when it actually has worked? Have there been times when you felt like you were better able to manage some of these things?
Yes, for like I said, like I'll etch out like an 8 to 12 slot on a Saturday morning. If I turn my phone off and I turn the TV off and just play really, really soft music, I'm able to master that for that day. I'm able to hit that goal of getting things done and complete. But it's like when I don't turn the phone off, I have loud music going, people are calling me left and right. I'm unable to complete any task that I have set before me.
Okay, okay. So we've noticed that if you're able to etch out some time on a Saturday between 8 and 12, if you're able to turn your phone off, turn your television off, maybe play some soft music and just kind of zone out from outer distractions, you've noticed that in the past you were able to do better
Yes.
as it relates to schooling and your balance and things of that nature. So let me ask you this. If you could do one thing, if you could change one thing and it would make this situation work out a lot better for you, meaning that you would find more balance, that you would be able to have more time and you'd be able to concentrate more on your work, what would that be? What would one thing that you would like to change starting today? It doesn't even have to be anything you think is attainable at this time, just something that you think that, if you just had a wish, I would like to change this one thing and that would make everything better.
Um, probably the level of rigor
Okay.
that I'm receiving, probably not as much. Like, I feel like they just cram it in my brain. And so that would be my wish. I would probably want it to be cut back a whole lot.
So you're saying actually the academic schedule or just the assignments and things that you have to do, if
Yes.
if you could change anything, you would change the amount of work that you actually
Yeah.
receive. Okay. Okay.
That's
what
right.
you're saying. Okay. All right. And so if you didn't have as much work to focus on a daily, weekly, monthly basis, how do you think your anxiety would be? Do you think it would be better? Do you think it would be on a scale of 1 to 10? What do you think it would be if you had less work?
It probably would be higher because then
Okay.
I would take on body's problems.
Because you would what? Say that again. I'm sorry.
Take on body's
You
problems.
would take on more problems as a result of that. Oh, okay. So that's interesting in and of itself. So tell me about a time when the problem is not occurring, when it's not affecting you very much. So tell me about a time when you're not feeling anxious.
When I'm doing absolutely nothing, I'm
Okay.
relaxed. I'm watching TV. I have me a glass of wine, and I'm just kicked back. No worries. Nothing's going on. Nothing strenuous is happening in my life. Kids are acting great. Grandkids are acting great. Nobody's bothering me.
Okay. 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 And on a scale of 1 to 10, how often would you say you had time to just absolutely do nothing on a scale of 1 to 10?
Probably about a 6.
About 6. Okay. So that's a little bit more than half. So there are times when you absolutely don't have a lot on your plate and you're able to just relax, have a glass of wine, and enjoy that time. Is that right? Okay.
Yes, ma'am.
Okay. And when you're doing that, you're not experiencing anxiety at the level that you're experiencing it when you have all of these other things going on. Is that right?
Yes.
Okay. Is there any way that you could see yourself managing your time in a way that would allow for some more of this relaxation that you talk about? Is there any way that you can see a different way that you might be able to manage your time to allow for more of that?
Yes, absolutely. If I stop procrastinating
Okay.
and waiting until the absolute last minute,
Okay.
that's where a lot of the stress comes from too, because I'm a huge procrastinator.
Okay. Okay. And how big is procrastination for you on a scale of 1 to 10? How big would you say that procrastination is for you?
Definitely a 10.
Okay. So you procrastinate a lot then.
Yes.
Okay. Okay. So maybe if we start taking a look at some of the things that you procrastinate on, what some of the reasons are that you procrastinate, do you think that maybe we could then start looking at reducing the level of anxiety that you feel on a daily, weekly, monthly basis?
Absolutely.
So maybe procrastination is something that we can start focusing on, and time management and things of that nature.
Yes.
Okay. Okay. Well, that's good. So what we'll do is, as we continue to meet and kind of tackle some of these anxiety issues, what we'll do is we'll continue to focus on procrastination, because it sounds like that if we could just get the procrastination under control, because you said it's at a 10, is that right?
Yes.
We could definitely start maybe bringing down your level of anxiety. Does that sound okay?
Yes.
Okay. So Samantha, we're going to start meeting. Is once a week okay with you?
Yes.
Okay, and we'll start trying to focus on maybe some of those procrastination issues that you talked about. Okay?
Yeah. Yes.
Okay, well, thank you. I appreciate you coming today, and we'll schedule you out for next week and we'll just continue to move forward. Is that okay?
Yes, ma'am. Thank you so much, Dr. Paula.
Well, you are very welcome.